Microdosing lithium was a game changer for my anxiety, and it's also proven to help protect the brain against things such as inflammation, Alzheimer's, and mental disorders. So in this video, I want to go over what lithium is, why it's a critical nutrient for your brain and nervous system, how to supplement and microdose it correctly to avoid toxicity and side effects, and I will also share the exact supplement that I take, which is the only that I recommend. Let's get started. Okay, so first things first, what is lithium? Lithium is a soft, shiny metal that is found naturally in our diet. The human body contains around 7 milligrams of lithium, and we get most of it from foods such as cereals, potatoes, tomatoes, cabbage, and some mineral waters. The problem is that the lithium content of these foods really depends on the soil that they were grown on. So people in different regions will have a different lithium intake depending on how lithium rich their soil is. In the US, it's estimated that the average adult gets anywhere from half a milligram to over 3 milligrams per day, depending on where they live. The exact roles of lithium in our body are still not completely understood because it's kind of an understudied mineral. We don't know as much about it as we do about other minerals such as magnesium. What we do know though is that its most critical role is for brain health. You see, lithium regulates the flow of sodium through nerve cells. Sodium stimulates nerve cells. So if you're able to regulate and stabilize this flow of sodium through the nerve cells, you're able to stabilize your mood. That's why many people call lithium a mood stabilizer supplement. Several studies have clearly linked higher lithium levels, for example in the drinking water, to better brain health and lower levels of things such as dementia, Alzheimer's, or mental disorders. Medicine has known about the positive effects of lithium for decades now. But the problem was that it's really only used in very high doses in certain drugs. These drugs are usually used for severely mentally ill patients, for example, very severe bipolar disorder. And they are very effective at treating these disorders. But unfortunately, at these very high doses, sometimes of several hundred milligrams, you see very severe side effects. For example, liver toxicity, tissue inflammation, and organ damage. So for a long time, really all we had when it came to our lithium intake were either natural foods or these very high dose medications that had these severe side effects. That's where lithium supplements come into play. They're the middle ground between natural foods and high dose medication. They can include doses from a couple hundred micrograms to several milligrams, but usually no more than 10 to 20 milligrams tops. This is how I got into lithium microdosing, through the normal supplements. I basically wanted the neuroprotective effect of lithium without the toxic side effects that you get from the medication. So I bought a low-dose lithium orotate supplement of 3 milligrams. Lithium orotate is lithium bound to orotic acid, and it's basically what you find in 90% of the supplements out there. I then started taking it, and after a couple days already, I noticed its positive effects. It wasn't much, but I just felt calmer and less agitated. And it also helped with the nasty side effects of copper dumping. If you aren't familiar with copper dumping and copper toxicity, watch my video on it where I go over it in more detail. Online, you will also find a lot of blog posts and articles saying that it helps with depression and other mental disorders. For example, one psychiatrist writes on our website, "I've used low-dose lithium for more than 15 years in my psychiatry practice, and it has consistently been one of the most helpful supplements for patients. I rarely see any side effects, and patients typically report feeling less depressed and anxious." Now, even though I liked the effects that I was noticing, I still wasn't completely satisfied. I still felt that there was a better way to get the lithium naturally. Now, most guides online will tell you that lithium orotate won't have any noticeable side effects, especially in such low doses. But I wasn't completely convinced, so I kept looking. And that was when I found plant-based lithium supplements. It's basically a supplement that you get from vegetables that are grown in high lithium soils. They are very hard to get, especially outside of the US, because there's really only one manufacturer in the world. But this form is probably the best because our bodies are used to it because the lithium is organically bound as it would be in any vegetable or grain that you already have in your diet. Now, the product is called Zyme or Cardiolith. I think Zyme is the old name and Cardiolith is the new name. And when you look at the nutrition label, you can see that one tablet only has 150 micrograms of lithium. That's nothing, but when I bought it and tried it out, I have to say that I noticed the same effect that I did from the lithium Orotate, and even maybe a little better, with less than a 20th of the dose. This makes it perfect for microdosing because I definitely wasn't risking toxicity and I just got the same benefits as if I were eating a couple of high lithium foods. So to wrap up this video, what's my verdict and recommendation on lithium and how to microdose it? I definitely believe lithium deserves more attention. It's super important for brain health, especially if you suffer from a mental illness or if you are at a higher risk of neuroinflammation. For example, if you have many cases of Alzheimer's in your family. In that case, what you want to do is to find the lowest effective dose that works for you. For me, that was taking one tablet of Zyme, which is 150 micrograms of plant-based lithium. Besides the normal lithium orotate supplements, which you would definitely have to take more of than 150 micrograms to notice anything, there also exist Ionic lithium supplements. This is a liquid form that contains lithium chloride, and it can also be used in lower doses than lithium orotate, usually 0.5 milligram to 1 milligram. I haven't tried it myself, but you do see it recommended online for microdosing purposes. One more thing to keep in mind though, and I talk about this a lot on my channel, don't just focus on lithium when it comes to your mental health. You also need to work on other nutrient deficiencies and imbalances. Common examples are a magnesium deficiency or a copper-zinc imbalance. All these can throw off your neurotransmitters as well. So don't see lithium as a quick fix for all your problems. Instead, see it as a good addition to your overall diet and supplement regimen, while you also try to focus on your other deficiencies and imbalances. When you do that correctly, it can really be life-changing.